Hello and welcome to this new session in our Bone Matter series. And today we're going to be talking about making decisions about taking osteoporosis medicines. And we're going to be going really beyond what the doctor or healthcare professional might be recommending and thinking about your role. Now, these are decisions not so much about which medicine to choose to take, although we're going to touch on that, but whether or not to take a treatment, whether to take an osteoporosis medicine. And for some people, taking a medicine is really quite straightforward, but we know not everyone feels like this. And for some of you, if you're listening, I'm guessing you still have questions and issues, and you need a bit of help perhaps before you feel you can commit to your treatment. So my name is Sarah Leyland. I'm an osteoporosis specialist nurse and clinical advisor at the charity, and I'm joined today by Professor Zoe Paskins, who's a rheumatology specialist doctor, but I think most importantly, really an expert on this topic. And she's done lots of research and worked with professionals and patients to support and make decision-making more positive. So I'm really delighted that you're with us, Zoe. Also has advised us with our new BoneMed Online service. More about that later. So thank you for joining me, Zoe, and welcome.
Thank you. I really appreciate being asked to talk about this, which is a really important area for patients. So delighted.
Well, a quick shout out for this new ROS BoneMed Online service. It's all about supporting you if you're taking an osteoporosis medicine, and you can find out more about it below the video and sign up if you want to join the programme. Well, back to medicine decision making. Let's just set the scene. Your healthcare professional will have assessed how strong your bones are and whether you would benefit from a medicine to strengthen them. And as with any medicine, it's going to be about weighing up the benefit against the cost. So by that I mean, is there any downside, any potential side effects to think about? It's probably, as you know, going to be about your bone density, if you've had that checked. That's one really important aspect of bone strength, but they'll also be looking at other what we call risk factors, things that may be affecting your bone strength over and above the bone density reading. So let's just start off briefly by you telling us a little bit more about what information the healthcare professional is going to be using to decide about your need for an osteoporosis medicine.
Yeah, so health professionals will use things called clinical guidelines, which are based on best scientific research, which guide them into which patients are most likely to benefit from being offered osteoporosis medicines. And as you said, those guidelines take in probably three main things into consideration. One is the bone density results, but that it's important that's not the be all and end all. The second is maybe a fracture risk score, so your chance of breaking a bone can be calculated. And the third are what I would call other clinical characteristics, and by that I mean things about you, whether you've broken a bone before critically, and all of those things together kind of fit together in a jigsaw. And so it's people who are at really increased risk of breaking a bone, who are generally are likely to benefit most from these medicines.
Thank you. Now, we know some of you, as I say, might be feeling unsure about an osteoporosis medicine for lots of different reasons, which we will be discussing, but something I think that maybe gets overlooked is really your personal beliefs and preferences. And so I know this is something that you feel is really important to understand. Perhaps you could talk a little bit more about some of the aspects of this that can affect decisions.
Yeah, so I guess when we have to make a decision about our health and about what we're going to do about our health, we think about the condition itself and what we think about that and how important we think it is. We'll perhaps touch on that in a minute. And then we think about what we think about the treatment that's being offered. And again, obviously, we're going to drill into that in a little bit more detail. But I suppose, the first thing to say is that we're talking about drugs, about medicines, and some people prefer not to use medicines if they can, and prefer to take natural options or lifestyle options. And I think in the case of osteoporosis and broken bones, there are lots of lifestyle things that we can do that positively help bone health. but they can't really be compared side by side with a medicine option, because what the medicines do is lower the chance of breaking bones in the future. And we know that from big research studies, but we haven't really got strong evidence that the lifestyle options lower your chance of breaking bones. They might improve your bone strength a little bit, but so that they're not really sort of comparable options.
Yeah, no, I think that's useful to know. But as you say, people do have their own views, which are going to play a part here. I think another thing I think is quite interesting is that some people don't want to take an osteoporosis medicine because they see osteoporosis as part of old age, and if it's sort of natural in that sense, why do we need to treat it? And it's interesting that they don't say that perhaps for heart disease and cancer, which are also conditions which get to be a much higher, bigger problem as we get older. So that's interesting, isn't it, really?
Yeah. So as I've just said, people think about what they think about the condition and what they think about the treatment. So if we think about the condition, I think osteoporosis is often not well understood at all. People get it mixed up with arthritis and joint pain, which is another condition which is associated with aging. And, as you said, lots of health conditions are more common as you age. But I think, as a rheumatologist, I would say this because I'm maybe a bit biased, but I think musculoskeletal conditions are particularly normalised by society in a way that's not very helpful, because there are positive things that we can do to stop them in their tracks, maybe even reverse them a little bit, improve them. And the fact that we kind of, think about bone weakening and arthritis as normal for age, it is difficult from that perspective. So again, if we're thinking about the condition, what do we understand by osteoporosis? So we know osteoporosis is a condition of weaker bones that are more likely to break. And if you say that to somebody, that they can understand, yes, if I fell on the carpet today, I might break my wrist or I might break my hip. And most people have got an idea of what that kind of looks like. I think what people don't have a clear idea of is what spinal fractures look like, because these can happen without any fall or injury. And actually the backbone compresses down over time, which can make your spine become more curved over and shorter. And again, this is something that is really normalised as part of ageing. That, I have to say, I've seen a patient recently who'd lost 8 inches in height and thought it was part of normal ageing, and so didn't see a health professional about it. But actually, she had 5 or 6 osteoporotic spinal compression fractures, of which, we know that if we intervene early, we might be able to prevent those. So it's really important when you're thinking about making decisions about medicine, have we got a clear understanding of what osteoporosis is, what that means for me, what, without wanting to scare people, what might happen in the future.
No, I think that's really important. So I think you're beginning to talk there about how we can help people who are feeling confused. So what's the first thing they might want to think about if we're trying to help them sort out their confusion? You've obviously said remember what the condition might do, but I guess the next bit might be, well, what's the benefit of the drug?
Yeah, so I think people often think about medicine benefits, but then they often might think, well, do I really need it? Do I need a medicine? And that's very much linked to, what are your results? What does the condition mean to you? What might happen in the future? And again, I've sort of touched on that a little bit, but that's a really helpful thing to talk about with your health professional. And if you're the sort of person that likes numbers, your health professional might be able to talk about your chances of breaking a bone over the next 10 years. And we know, particularly for people who've already broken one bone easily, we know that they are much more likely to break more in the future. So the need is about trying, doing what we can to lower the chance of that happening again. Okay, these medicines aren't medicines that make you feel any better. They work silently in the background to strengthen the bone and lower the chance of further bone breaks. And if you've already had one painful or disabling bone break, you will know what that means to you.
Yeah, so it's really about thinking about the benefits. So on the other side, we know that people worry about side effects or risks to their health in the future caused by the drug. Do these matter, and how can we help people sort of sort these out in their head, and are there ways to reduce some of these?
Yeah, absolutely. So after thinking about, do I really need a medicine? The next question is, well, what are my concerns about it, or what are the what might be the side effects. So everything's got side effects. So it's thinking, so with I mean, obviously there's lots of different osteoporosis medicines, but if we think about the tablet ones, for example, the most common side effect is irritating the gullet, causing indigestion or acid reflux or that sort of thing. And with most of the side effects, there are ways that you can positively reduce the chance of them happening. So, for example, with the tablet medicines for osteoporosis, there's a certain way of taking them where you sit upright after you've had them, have plenty of water with them and things like that, and that helps reduce the chance of side effects. Many of the osteoporosis medicines have also got rarer, more serious side effects that can concern people. So, for example, the jawbone problem that can happen with a problem of the jaw healing if you have a dental extraction. And so I guess, again, with these things, what I say to people is, first of all, they're very rare. So for what that means is that for every 1,000 people taking the medicine, for 10 years, less than one person of those 1,000 people would have that rare side effect, which means 999 of them wouldn't. And the other thing is, just as with the common side effects, there are positive things you can do to lower that chance. So having good dental hygiene, to keeping your dental checkups and things can help lower that chance as well. So it's thinking about, and you said, do these matter? Well, that's very personal in terms of how people feel about those things and whether they're particularly concerned for people.
Yeah, and perhaps I should say here that we do have lots of other resources about this, discussions with experts and so on, and we'll link you to those underneath the video if you want to find out more. Yeah, so that's really great. Now, most of the medicines are fairly straightforward in taking them, but I think there can also be practical things, can't there, that people need to think about. Anything particular here that you think is an issue which can perhaps be sorted?
Yeah, so with the practical issues are really important, and how the medicine fits with your life. So, for example, the most common tablet medicine, which is taken just once a week, which is quite convenient, but does have a special regime around it in that you need to have it first thing in the morning and fast for half an hour afterwards before you have any other medicines or something to eat. For some people that doesn't fit with their life or their other health conditions or their social responsibilities or whatever. So it's really thinking about, does it fit with my life? And I suppose when we think about hospital-based treatments, then other practical things might come into play, like whether people are comfortable having injections or not, or giving themselves injections, needle phobia, travel, transport, getting to hospital, having to have blood tests before and afterwards. So these are all some of the practical things that can be thought about, and important to bring these up with health professionals. As a health professional myself, I think it probably often we might neglect this a little bit in thinking about that fit with the person's life. So I guess my message would be, don't be shy about bringing those sort of things up, because they're really important, and the health professional might just have forgotten to acknowledge that, but would be very happy for you to say if something was difficult.
Yeah. Great. So let's come on to the decision-making bit then. I mean, when you're advising people, and perhaps for those listening who are uncertain, what do they need to think about? What do they need to think about when they're making the decision?
So I would say there's three things. So I like to think in threes, and then there's three elements. So the first thing is, do I feel like I know enough about the three areas we've talked about? So what why has it been recommended, and do I need it? So that's the first area. Any concerns that you've got on the side effects, and then the practical things and what's involved. Do you feel you've got enough information? Because if you've got any questions or queries about those areas, that's where it's helpful to get more information, either from the Royal Osteoporosis Society and the resources you've mentioned, or from your health professional. The second thing to think about in terms of making a decision is what matters to you most. Or the flip side of that, it might be, what are you most worried about? So, and so linking to some of the things we've mentioned about, how important is it to you to maintain your independence over time, to protect your spine, thinking about the benefits, versus how worried are you about some of the side effects, for example, or how important is your social responsibilities that mean that actually the practical issues are getting in the way. So thinking about what matters to you most of all of those things. What's the thing that's going to keep you awake at night? And then the third thing I sometimes say to patients that can be a helpful sort of thought exercise is to think about decisional regret. And what I mean by that is if you decide, if you're on the fence a little bit, veering towards thinking, I'm not sure I do want to go ahead with whatever has been offered to you, to think about how you would feel if in, say, 2 years' time you sustained a fracture to your spine or something and your body shape changed or you had pain and so on. And looking, if you project forward, how would you feel looking back on your decision? Would you be regretting it? And sometimes, not for everybody, but for some people that can be a helpful exercise. So summarize that, I'd say, do you feel you know enough about why it's recommended and what the benefits are, your concerns and the practical issues, what matters to you most? I think they're the main things.
I think that's really helpful. Thank you. So really helpful guidance there for our listeners. Let's just kind of quickly summarise. You've probably almost done that really, Zoe, but main messages that you want perhaps to give to our audience who are in the position of making a decision.
Yeah, so I'll reiterate them again. I don't think there's any harm in that. So it's thinking about, why do you need this, or why would it be helpful? Do you feel clear about what the benefits might be to you over time? Have your concerns been addressed, and the practical issues and the fit with your life? And then thinking really what matters to you most, what's going to keep you awake at night, and then link to that, would you regret your decision in the future? For some people, they will decide that a medicine's the right thing for them. Some people will decide it's not the right thing for them. And I think that's absolutely fine, as long as you've made an informed choice with all the information. As a health professional, we respect people's decisions. I hope we do. But things are never fixed in time, I think, is the other thing to say. And things can change. Your perspectives can change over time. So, and again, that's absolutely fine. So it might be worth revisiting decision making, either way, consciously, particularly if any of your life situation or circumstances change. And one final thing I would add, if I may, is just to say, as you said at the beginning, this is an area where we've done a lot of research at Keele University, and we have produced an online tool to really help guide patients through all of the things that we've been discussing, to help them make decisions about medicines. There's a few available. They're called Osteoporosis Options, and they're going to be launched later in the year. So we'll put the links to that information below the video.
Thank you so much, Professor Paskins. That's been really helpful, and to you all for listening. And I think, as we've said before, we hope you're feeling more confident, and that you know where to get more information if you need it. And there'll be lots of links below this video, including information about BoneMed Online. So thank you, and thank you, Zoe.